Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, originally intended for presentation at the 2017 Undergraduate Summit. ASPPH presents Integrating Advocacy into the Undergraduate Curriculum. Today's webinar will be 1 hour in length. We will begin with a short introduction of our presenters, followed by their presentations, and allowing time at the end for questions. This webinar is part of the 2017 ASPPH Presents webinar series and has been approved for 1 hour of CPH continuing education credit. The webinar will be recorded and it will be available on the ASPPH website in the archived webinar section soon. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. We are pleased to have with us 4 speakers today. Elaine Auld is the Chief Executive Officer for the Society for Public Health Education, or SOPHE, the only independent nonprofit professional organization representing behavioral scientists and health education specialists in all settings. Ms. Auld oversees SOPHE's portfolio of professional publications, meetings, cooperative agreements, and advocacy. She has spent some 30 years working in health education with publications and interests related to credentialing and standards, workforce development, public policy, and health equity. Cicely Hampton is the Senior Director of Health Science and Policy at the Society for Public Health Education, where she leads the association's legislative and regulatory advocacy activities that address public health, health disparities, school health, and health education, in addition to planning and conducting advocacy trainings. Prior to her joining SOPHE, Dr. Hampton worked as a policy analyst with the University of North Carolina at Charlotte, where she evaluated health outcomes for North Carolina's Medicaid program and developed a theory to measure health status. Keely Rees is in her 18th year as professor in the Department of Health Education and Health Promotion at the University of Wisconsin-La Crosse. Dr. Rees' research and teaching has focused on numerous issues in the health field for over 20 years. Her research has focused on prenatal care, exercise prescription and behaviors during and after pregnancy, social support for preconception and prenatal nutrition, tobacco use during pregnancy, and sexuality education and advocacy for young children, teens, and parents, and schools as community outreach for nutrition exercise. Dr. Jennifer Glassman is a certified speech-language pathologist and certified health education specialist. Her expertise includes hearing loss and speech-language development in children. Her research areas include health behaviors of people with communication disorders, preventive care and behaviors, and health risk messaging, and improvements in technology for those with communication deficits. Thank you all for being here today. We're looking forward to your presentation, and at this time, I'm going to turn it over to Elaine.
Thank you, Sarah, and good afternoon, everyone, and thank you for taking time out of your busy day to join this advocacy webinar 4-part series, actually, that we have prepared for you today. First, you'll hear a little bit about the health education and CPH competencies that are related to policy and advocacy and how these undergird the annual Health Education Advocacy Summit now in its 19th year. We'll talk a little bit about how that some of those summit lessons learned have been applied at the local level, and then how to integrate policy advocacy skills into your public health curricula and gain administrative support. And finally, a great example of how undergraduate students have applied policy competencies to help their campus achieve tobacco-related objectives. I'd like to add today that not only for those on the line, but for those who might be hearing the recording, that this doesn't just apply to undergraduates. Certainly, we will be talking today about graduate competencies and more advanced competencies, and how this has also been very helpful to both faculty and practitioners. And in terms of our major policy objectives today, how all public health professionals need to be prepared. Moving forward. Okay. So just to quickly get started, for those that aren't familiar with the Society for Public Health Education, as indicated, we are the only independent organization devoted completely to health education, health promotion, and behavioral sciences. And for 68 years, our mission has been focused around providing global leadership to the profession of health education and health promotion, to promote the health of society as a nonprofit professional organization. We have 4,000 members across at the national level and in 21 chapters, and that, as well as 25 international countries. We are set the field's professional preparation and practice standards by doing a psychometric competency study every 5 years that's used for to undergird the curriculum, and also advancing research and practice. So SOPHE publishes 3 peer-reviewed journals. Hopefully you're familiar with all of these, as well as 2 textbooks. We do about 40 webinars ourselves a year with continuing education, as well as having an annual conference that attracts about 1,000 people each year. We'll be meeting next year in Columbus. And then, of course, why we relocated to Washington was to be more engaged in policy advocacy with other organizations such as ASPPH, the CDC Coalition, APHA, Trust for America's Health, and many other public health and education partners. My builds are a little bit slow here today, so hope you. A couple of our textbooks and our policy advocacy. So really to talk a little bit about the next step is really looking at why is it important and so vital today to make sure our students are up to speed on all advocacy skills, everyone from the entry level to the doctoral level. We really saw a transition in the late 90s. If they think back that far, I've been in the field for many years and see the discipline change from a paradigm that was very focused on individual behavior change to saying we need to really engage more at the population level and address policy change. And some of the earliest documents looking back to those late 90s, not only those special issues that SOPHE was publishing in its journal, but also Healthy People 2000. And just as an example, one of the objectives from Healthy People 2000, if you can think back that long, we're now working on 2030, of course, but there was objectives there like increasing the average state and federal combined tobacco excise tax to at least 50% of the average retail price of cigarettes and smokeless tobacco, or enacting in 50 states in the District of Columbia laws banning cigarette vending machines except in places inaccessible to minors. So we have a very, very long history in our field of really knowing that we have to do capacity building for advocacy. In 2003, SOPHE and ASPPH and other groups testified at the IOM on who will keep the public healthy, which was one of the first major documents to call for more training for students and practitioners in policy advocacy. Our CHESS competencies, those that undergird the Certified Health Education Specialist, first published in 2006, formal competencies that we're studying around improving policy advocacy. And then, of course, the Council on Linkage Public Health Competencies, where SOPHE is also a member there, has a very firm foundation for competencies in policy advocacy, and then all the way up into present day, where our former CDC Director, Tom Frieden, Health Impact Pyramid, that's still referred to today, talks about the importance of changing the context and the long-lasting interventions and high-five interventions that we're now dealing with today, as well as social determinants of health, which are now reflected in the new framework for the Healthy People objectives. So what are some examples of the public health competencies that really should be undergirding our continuing education as well as our professional preparation at the undergraduate level? And here I've just showed you the Area 8, which within the health education competencies encompasses communicating, promoting, and advocating for health education promotion in the profession. We have 2 core competencies there. Engaging in advocacy for health and health education promotion, and influencing policy and or systems change. And under that, we'll align 9 or 10 sub-competencies in those areas. And you can see they range from identifying the emergent issues requiring advocacy all the way up to leading advocacy initiatives, and then using evidence-based findings and policy analysis, engaging in legislative advocacy. So clearly calling for our students to be prepared to undertake such to be able to be effective public health advocates. At the advanced level, or what we call the MCHES level, the Master Certified Health Education Specialist, we have even more advanced kind of competencies there related to policy development and using policy advocacy activities or techniques to influence decision makers. Looking at the core competencies for public health professionals, and this is the latest version published in 2014 from the Council of Public Health Linkages, we see that policy development and program planning are a key part of that. There's 6 competencies. If you go online and look those up, especially in Tier 2 and 3, which tend to be where our undergraduates and our graduates are going to be placed in terms of responsibilities for their jobs. They would be developing options for policies and programs and services, determining the feasibility and implications, and then influencing policies and programs. So even moving forward, finally, to the ASPPH Framing the Future, the second 100 years of education for public health, of which Sophie was a part, it also calls for the critical content of the MPH degree in the 21st century to be able to address the legal, ethical, economic, and regulatory dimensions of healthcare and public health policy, and approaches to developing, evaluating, and advocating for public health policies. And certainly if you look at the DRPH competencies, you will also see advocacy reflected. If you go to the opposite direction and look at the AB degree or the community college kinds of policy advocacy objectives there or competencies there, you will also see the need to be preparing effective public health advocates way from the start of their early education. So we have a very firm foundation of what undergirds the Advocacy Summit, that we know that our public health students need this kind of training. I have been involved in the summit since 1998, where it was really clear to me when I came on board that we needed to do a lot more training in this area. That first year, we started with 9 organizations in the Coalition of National Health Education Organizations, including APHA, with about 40 leaders. And since then, Sophie's been the annual convener. Now we're in our 19th year. We've grown to about 150 to 200 attendees annually, as you can see from this great photo that we had on the Hill. And we've had over 2,000 faculty, students, and practitioners trained, all of whom come on their own dime. There is no support that Sophie provides. We do provide some student scholarships to our own members to attend, but on a limited basis. But most of these people here are coming because they really want to learn and raise their voices for public health. So I'm going to give you an overview in the next few slides of what the Advocacy Summit has been about. We've really honed that process, I think, over the 19 years that we have offered it, but pretty much have kept some core summit advocacy objectives. So we want summiteers to come away with new advocacy knowledge and skills so that they become effective policy advocates at the federal, state, and local levels. So not only just walking the talk while they're here in Washington, but more importantly, I think even going home and what they can do on their campuses and what they can do at their state and local levels and influencing their chapters or their other public health organizations and coalitions where they are involved. We certainly want them to be able to articulate our federal policy priorities related to school or public health education, developing and enhancing personal relationships with policymakers. So much of the effectiveness of policy advocates starts with that personal relationship, and I think that's something that's often lost in this process. And then finally, being able to identify new colleagues to strengthen their future advocacy efforts. We find a lot of the folks that come to us for the first time, when we organize them by state delegations, didn't have an idea of other people working across maybe even 100 miles from them that might be working on very similar issues, or how they can gain more traction working together. So we really try to encourage that team building within the summit. So overall, what does that 2.5-day summit look like? We typically hold this over a weekend to be able to minimize the time away from the classroom. But Saturday afternoon, starting at about 1 in the afternoon, we do some intensive skill building. And we have a variety of tracks, anywhere from the beginner advocate, those that are just coming, waking up to the idea that this might be, this is an important responsibility that they need to have gained further training. To those that have been, maybe those that are returning to a summit the second or third time, we want to make sure we offer advanced sessions for them. We have dedicated sessions for faculty as well. On Sunday, really the orientation is that they come to what is the current climate of Congress. Of course, it's changing every year, and importantly, especially this year. And we have keynoters that can kind of give them that overview. We talk about our priority health issues for the year. So that's something we do in our summit planning, is try to hone what those advocacy messages are going to be. We actually involve them a lot in role play and demonstrations of what actual visits are going to be like, to take away the nervousness and fear that one has, anywhere from the very seasoned faculty member to the student. I know has a little bit of trepidation of walking into a congressional office for the first time. And allowing them to actually use time to sit in their small groups and practice how they're going to make the introduction, to how they're going to make the ask at the end of the visit. And then on Monday, we actually go up to the Hill. They have an orientation to life on the Hill. We've had a variety of our summiteers who have been graduates, if you will, who are now working on the Hill, be able to come back and talk to students and practitioners who might be thinking about future role for them on the Hill. They actually conduct their Hill visits throughout the day, and then document what the response and any necessary follow-up needs to be, not only from them, but maybe from our Washington office here, on what we can do to see, to follow up with staffers or congressional questions. In terms of preparation, we try to really make sure that those that are registered for the summit are coming in and building the excitement. We use a lot of social media to do that, trying to, again, connect attendees before actually coming to the summit. We are going to be holding 2 webinars, in the next one this week and one in the coming weeks before our summit in October, to help prepare them. And then giving them specific homework that faculty can also link in with, in terms of knowing their state, knowing the voting records of the individuals they're going to see, being able to bring back those local stories, which are so impactful in the testimony, and in this case, the importance of programs and funding, and then registering for the Hill visits, which we're actually we able to use through some of our software to help facilitate that process of getting them a Hill visit. So our summit priorities are something that are selected from year to year. We do have many of those that relate back to CDC funding and NIH funding, because many times, especially CDC, we find many of the staffers still have a need to understand what CDC does, and the fact that the funding goes back at the state and local level. We've advocated for issues such as the prevention research centers, racial and ethnic approaches to community health, the funding for DASH, or the Division of Adolescent and School Health, the Preventive Health Services Block Grant, just to name a few. What's great about this, I think, as it relates to faculty, is that there's a link for experiential learning, both before, during, and after, as you can see. By assigning homework, but faculty can get their students engaged and ready. They have the experiential learning of where they're actually coming here and doing the role plays and doing their Hill visit planning, and then going up to the Hill, and then following up with their legislator and doing various class presentations. You'll hear a little bit today also from Keely about what's been done as a post-summit activity, but things that have, just as other kinds of examples, that again links this back to maybe course requirements or part of their policy advocacy curricula, is encouraging them to do letters to the editor or op-eds or things in local campus newspaper, connecting to other student service initiatives on campus, organizing the campus a summit on campus or locally, incorporating student case studies into their future courses, and then certainly helping future students be mentored by the graduates who go through the summit. In terms of impact, In terms of impact, we have seen appropriations increases over the 19 years. We've actually been able to influence congressional questioning during testimony due to the fact that we are sending up 200 or more advocates to the Hill with the common messages. They might be seeing as many as 4 offices during their time here, and so we're actually able, last year we were able to make 300 visits and drop 300 drops to different offices. We've certainly seen that our organizational training that Sophie's been able to provide has been strengthened through this process, as well as things that have happened on local campuses and state chapters of Sophie and Eta Sigma Gamma. We've had some Summit graduates move into politics at the national and local level, and then really seen that this activity has helped increase our capacity to mobilize across the profession. So just taking away the other 362 days of the year, we have a very large component now of trained advocates that we can rely on as we get messages out. So very quickly here, just to give you a preview of the Advocacy Summit coming up, it's October 21st to the 23rd at Washington Court Hotel, which is right here at Capitol Hill. Among the featured speakers we have are the APHA president, the TIFA president, and Larry Cohen, the CEO of Prevention Institute. We have a wide variety of faculty and student skill building sessions for Saturday afternoon that are included. And our priorities this year are the Prevention Fund, still a very, very critical time here in Congress that if we don't have that large undergirding for prevention in future budgets, we certainly will be rolling back a lot of the progress we've made in public health, and there's still a lot of misconceptions about the Prevention Fund. So we're hoping to bust those myths. And in particular, about half of the funding for both the CDC Office on Smoking and Health and the Diabetes Program come through the Prevention Fund, and we hope to be able to talk about those local stories of why the funding for these programs are so important to continue. Our upcoming Advocacy Summit webinars to participate, again, it's free of charge. We're looking at trying to, this week, talk about the bipartisan vision for advancing community prevention. And then Advocacy 101 will follow in about 8 days after Wednesday. So these are open for all summiteers as well as others who are interested in learning a little bit more about the summit. And then finally, about a couple weeks after the summit is held, or a week after, we are going to bring all those summiteers back together to talk about applying lessons from the Advocacy Summit. The summit is very affordable for both students. We've put the high priority on this, where for student Sophie members, it's $195. You can get more detail about registration in the detailed agenda on sophie.org. This includes meals, materials, CHES and CPH credits. And then for those that are certified or want to become certified health education specialists, we're also offering the exam in collaboration with NCHEC on Saturday morning so that they can come. So I certainly hope some of you will check it out, and thank you for your time and attention this afternoon. We hope that you will work with us in, not only in the summit, but also in future areas to empower our undergraduates with 21st century policy advocacy skills. Thank you, Sarah.
You're welcome. Thank you. And then, Keely, I'm handing over the controls to you.
Terrific. Good afternoon, and thank you, Elaine, for that great intro and sort of setting the stage for what has been going on, what's going on currently. And this is just such a great example of collaboration at its finest. I'm going to speak a little bit about this idea of how we have looked at the Advocacy Summit at the national level, and then how some states can take that back home and do some state level advocacy experiences, different than the summit, but sort of replicate and then teach students and community members and other engage with other state organizations or state chapters of SOPHE or American Public Health Association. And so this overview of our advocacy participation kind of comes from this idea that like in our state, and I'm coming from the state of Wisconsin, we have had a long-standing history with the national summits and bringing our students, undergraduate and graduate. And then about we collaborate heavily with our Eta Sigma Gamma local chapter. So we also work heavily at the national level. I used to work with the National Eta Sigma Gamma on advocacy. And again, it's about working with the local chapters to bring their students, and often that's a way for funding to happen through a local Eta Sigma Gamma chapter. They're very savvy at raising funds for this very sort of thing. But then also in our local department, we have a lot of departmental support. We have a lot of college support. And so we have administrators and that took time. That has not always been the case. And so what a lot of our work is doing is taking it back from this national summit and saying, how can campuses better align these sorts of experiences with what they're doing back at home? And so you might not be able to send a large group every year to Washington, D.C., but how can you maybe replicate this back in your state? So we have a lot of leadership in our department, as well as our college campus and our deans. And then we have a lot of local advocacy with courses and projects going on, and community organizations and nonprofits and community-based leaders that are willing to have our students engaged in a lot of advocacy efforts. So this one particular thing that I'm talking about, well, and I was mentioning this, I guess, is the departmental and college support. We've done a lot of campus advocacy, and that turns into community advocacy, and then some county advocacy. And every state and every region really would be able to do these sorts of things, and in their own backyards, there's already these things existing. It's often just connecting with them, collaborating, and then trying to figure out how this might work in your department. And so our faculty and our community members are very much a part of our advocacy work in our region. And these are just a couple of the examples where we have a heroin task force that's very active and in our state. And we have local faculty bringing in students with our county advocacy. We have local community projects with Drop It and Drive regarding texting and driving. And then our campus stuff hovers around a lot of different outreach on tobacco or nutrition. This happened to be a Get Out the Vote project. With that though, I guess I'll go back there. So our department and our, not every campus has sort of a champion that's making this happen, but a lot of times going to the national summit, this is what can happen. And then our job is then how do we translate this and give faculty, staff, and others in their state chapters these sort of skills to bring this back. And that's been the key, is to kind of have that one or two or three champions. This is an example of our public health legislative gatherings. Many states have these, many regions within a state, where you're bringing together your local district representatives and assembly persons, or even your state offices, your federal offices, and having a representative. It might not actually be your senator or your representative, but maybe their state person coming in, and we hold forums 2 to 3 times a year in our region. And so our students are very engaged in that process, from setting that up to attending to what are the advocacy alerts or asks or sort of awareness things that we need to bring to the table. And this is one of our local district, Jennifer Schilling speaking there, and who's also a very big champion for public health. And then on our campus, we started doing very formalized state advocacy experiences for our local graduate and undergraduate students. And we started in 2015, held one in 16, held one in the spring of 17, and we will be holding one again in February of 2018. And again, we very much emulate this after the summit and bring in anywhere from 20 to 40 students to our state capitol, and have pre-conference workshops, orientations, webinars that they can watch related to the state issues and representatives, and sort of getting them very involved in that. So the key is partnering with our regional and our state officials and representatives, and our students are very good at helping come up with campaigns and social media. And then this turned into a research project because we really felt like this was so important to start looking at the impact, as Elaine kind of alluded to. You know, we know the impact it has on people's skills anecdotally, and we've done a really good job of tracking that. We can also track what kind of effect large groups coming in to these offices has in terms of our public health agendas and our public health awareness campaigns and projects. But really, we wanted to take that to the next level. And so that started in 2016, when really we decided to look at the purpose of investigating whether advocacy training and an in-person experience outside of regular academics improves their advocacy knowledge, confidence, skills, intentions, and then their practices after they engage in a summit experience. So we did this 2 times at our state level advocacy summits in 2016 and 2017. And we had 2 different groups, 23 registered the first time, and then the second year we had 16 attendees. And this last time we actually had 40 people in total, but we started engaging them in a pre-test, post-test. We did focus group following up this experience and had a debriefing session with them. We also followed up with the legislative staff that our students and graduate students had met with their faculty. And then in 2007, we had a much larger comparison group and a much larger group of participants to compare that with. So now we have 3 nice years of state level data that is helping us better understand what's happening when we do these experiences in terms of their knowledge and really their confidence, and then really their intentions of doing advocacy work post an experience like this. And then in 2016, Dr. Cedergrant and I reached out to Elaine and Cicely and Dr. Amy Thompson and really started the collaboration of doing a similar follow-up with the participants that attended the 2016 summit. And there were 120 registrants that participated in the project, meaning that they took part in a pre-test, a post-test, and a 3- and 6-month follow-up after the summit. And it has been really exciting to take that to the next level. So just to give you a little idea, you know, we were kind of putting out, you know, just the level of, so this is at the state level, how excited and they were in terms of how much experience they had. And so this is their state level experience. How much experience do you have advocating for health? A lot of them in the beginning, as you can see, said none. Some of them said that they're comfortable. Some of them said, how well do you feel like the training's prepared them? Very well. So again, just getting some of that real quantifiable data that helps you understand if what you're doing is making an impact. And here you can see the pre and post, where we're really looking at how comfortable do you feel identifying current and emerging health issues regarding advocacy at pre-test in the maroon or the salmon compared to in the yellow. We saw nice increases on both on all 3 of these items. How comfortable do you feel engaging stakeholders in advocacy initiatives, and how comfortable do you feel complying with organizational policies related to participating in advocacy? Because that's a big reason often why individuals don't engage in formal advocacy, because of that fear of how it may interfere with their work places. And so we really spend a lot of time discussing that. And then you can see at that post level, we saw increases in all of that. And same thing with accessing resources is the first one. The second one is developing advocacy plans in compliance with, again, the policies and places that they work. And then how their comfort level of using those strategies to advance advocacy goals. And again, a nice increase with the majority of our participants. And the second one is the last one is the pre-post test of how comfortable do you feel implementing advocacy plans and evaluating advocacy efforts and leading advocacy initiatives. And that's, I think, one of the exciting ones on the bottom is to see that there's significant increase in their confidence in leading something like this in a future scenario or setting. So very positive. And I'm going to flip through some of these a little quicker just in light of time here. because they're, as you can see here, they're very positive. We see in the post-test on all of these things that ultimately they're feeling very comfortable. The main thing we were really asking about in our focus groups was to look at training. How well did the training prepare you? The 2-day training, the webinars coming up to it, how did it influence their understanding and so forth, and just sort of what would they like to see differently in the future. And those just really help us, with program structure, advocacy in action, really helping overcome their fear, the trust in the process, having these conversations versus a presentation in these legislative offices. That was a big theme we saw over and over at the state data as well as the national data. Their changes in mindset from being educated to educating someone else. And, just that upper level student, they felt very professionally prepared in that way. And that was sort of a neat thing to see in some of that stuff. Some of the other ones that, of course, these experiences are intense. It's 2 days and then a day on the Hill, but very, helps them really identify their, opportunities for advocacy in the future, and those personal and professional growth opportunities are just incredible. And we hear that anecdotally year after year at the state as well as at the national level. And that's just exciting, and it confirms those things that we hear anecdotally. The legislative piece was exciting too. We heard from the staffers and received feedback from them. And it's really great to sort of be able to hear how those messages were received. And especially at the state level, we have a really good relationship with our state legislators and their legislative aides. And just getting that feedback from them was really helpful to better identify, how do they feel this impact. We were talking specifically about reimbursement for community-based preventative services, how this office chooses to do things in the future with this, and just kind of following up on the issues as well. But it gave us these 2 key ones in red. How supportive would you be to having students visit your office on an annual basis? They felt, supportive about that. And then following advocacy, how likely are you to consider contacting individuals? And that's what we really wanted to find out. And, that's a mixed bag there. It's, they don't often have the time to seek us out. So we heard often again that it was important that we reached out to them. Okay, and then I'm going to turn it over to Cicely at this point.
So as Keely mentioned, last year we really wanted to see the impact of the summit on our participants. So we borrowed many of the elements of the Wisconsin evaluation that Keely just spoke about to adapt to the national summit. So as she mentioned, we sent a pre and post summit survey to all participants with 3 follow-up surveys along the way to see the longitudinal effects of attitude, readiness, and willingness to advocate on summit participants as a result of the summit. So in total, we had 32 matching evaluation surveys over time in all of the different pre and post tests. And all respondents reported that their advocacy skills improved over time. And this result was significant at the 0.05 level. In addition to the boost to participants' advocacy skills, the participants also expressed an increase in their intent to advocate. So that was also improved. And that's one of the things that Keely mentioned in terms of comfortability with their workplace priorities and things like that. So some people that thought that that was actually a barrier found out that it wasn't, and that this increased their intent to participate in advocacy actions. Our results indicate that the summit is fulfilling its stated need and purpose. In the 2017 evaluation for the summit, in order to strengthen the evaluation, we are adding a control group of SOPHE members for comparison purposes, just to make sure that indeed it is the summit that is that contributing factor, and to boost reliability of the evaluation reports. And based on the health education competencies, we know that there is an incredible opportunity to advocate for the role of health education in public health. Several opportunities have been identified based on the results of the evaluation. One is to incorporate the National Summit into advocacy curriculum, and bring students so that they can really put their lessons learned in the classroom to work and to see the immediate and sustained impact of their advocacy work. So now I'm going to turn it back over to Keely Reese to talk about how to further identify ways to incorporate advocacy in curriculum in public health in ways that fulfill both faculty responsibilities and are translational in nature.
Okay, and I'm off mute. Thanks, Cicely. And this has just been a really exciting collaboration. And as she mentioned, just when the future recommendations and strengthening this year has just been a big piece that we've been excited about at the national level, as well as being able to then demonstrate how this is having an impact and what the intervention, it being the summit, has over time. And we just really appreciate the ongoing collaboration and from all aspects of working in SOFI and working with our colleagues. It's been a really neat opportunity to be a part of. So with that, I think it's letting me advance this. There we go. So my next, how this kind of ties into, so this research being translational, and it's always this idea of what sounds in theory really great or on paper, or how do we put that into practice? And that's what we really feel like between the state level research project and the national level research project, we've been able to really demonstrate how those things are translational, and that it isn't just sound good on paper, but it actually does work. And so one of the things that we feel really vitally, that's really important for academic institutes that are preparing undergraduate and graduate students is, how do we, not everyone has access to taking a really large group to Washington, D.C. or to a state capital. And more importantly, how do we make sure, and this goes back to how Elaine started this webinar off, is making sure that we are really addressing these from the national professional organizations, but also from the credentialing bodies that are really setting standards and criterion and competencies and sub-competencies for our students, and then helping faculty figure out how to incorporate these things into the classroom and map them into a curriculum. And that's what we've been doing for the last 2.5 years, is really making sure that it's incorporated into our curriculum, grad and undergrad, and of course using these. And these are even some of the things that you very much saw Elaine start off with, but really coming from that, what is health promotion? Many campuses across the nation are guided by the NCHEC, the National Commission of Health Education Credentialing, and the 7 areas of responsibilities. But many programs are going through CEF accreditation at the grad and undergraduate level, and also having to identify, well, when we put things into a course or into a project and an assignment, how can we best use Bloom's taxonomy and assess these things to determine their skills and actually look at outcomes that are working. So one of the things we did, and this is just a really, this just shows how our curriculum evolved and how we have moved into somewhat of a cohort model, where at our undergraduate public health, community health education program, they are really learning about advocacy from block 2 all the way into block 3, with a full-fledged health policy, advocacy, and community organization course embedded in the middle, and then following up with their resource management and grant writing class, implementation, evaluation, and their senior capstone. And our students in our program have the ability to participate in these state or national projects and campus-wide projects, but also as part of a course. So even if they cannot travel to these summits or experiences, they're going to have access to coordinating it and administrating it in their coursework, and working with local community organizations to lead local advocacy efforts. And so we really use this model. This is a really big model to look at, but this is what drives our program, where we're really looking at it from individual behavioral beliefs on the very left-hand side, looking all the way across the grid to the right at intentions. How does the curriculum become intertwined into this? How do we, on that bottom one, give a second experience or additional training? And then how do we move that into state health issues, bills, business cases, state health policy, and so forth, and then, you know, apply those elsewhere in their curriculum, as well as being able to assess those things. And so that's really how we've done that. And in short of time here, I just want to say that our projects in those courses are project-based learning, so they're competency-driven, and our program student learning outcomes have that connection to NCHEC and the Council on Linkages, and we're usually addressing PSLOs, or program student learning outcomes, where our students are proficient by the end of the course or the experience. And in this case, our policy class really addresses applying public health concepts to policy development and program planning, and communicate and advocate for health and health education. And then we, of course, we break that down. And the 4 ways in which we're doing that are our local legislative gatherings that are held fall and spring, our state Advocacy Summit, where they plan and coordinate with Eta Sigma Gamma, they implement it and they evaluate it, so as part of a course experience, but they can also participate at the actual experience. And then our policy work with projects and local community-based organizations, and then we do a lot of local community development in the course as well. And with that, our implications are, you know, just that, as Cicely mentioned, this comparison group at the national level is that was a big wish list last year, and we have done that, and we'll be implementing that here this fall. And graduate level courses are, you know, and many campuses do that really well at the graduate level, and just how do we have those same sort of assessments and opportunities at our MPH and our DRPH levels. And then having graduate assistants, research assistants, you know, assist with coordination and getting them those hands-on skills, similar to like an intern would have, that might be working with SOPHE or APHA or other organizations doing this kind of work, and just teaching others how to make this work on their campus and their state level. And I'm going to turn it over to Jennifer.
Hi, everybody. I just want to say thank you again for letting us talk about what we've done here in Toledo, Ohio. And we're going to hear some of the same themes, which is great that we heard from Elaine, Cicely, and Keely about partnering and student involvement, and of course, student empowerment after that. So some of the things that we've had going on here in Toledo, and what we have our students working on, we've had success with having a tobacco-free campus that was driven by student. Trying to see if I can get my slides to forward here. There we go. That was student driven, and what we've been working on lately is this Tobacco 21 campaign. So why would we want to increase the purchase age for tobacco to 21? Seems kind of obvious to us, but we know that a vast majority of smokers who begin smoking before they turn 21 are twice as likely to become lifetime smokers. So we're really trying to push this initiative through as quickly as we can in as many places as we can. So Tobacco 21, or T21, is a strategy that we use in concert with other programs that are already in use to reduce smoking or tobacco use among our youth and young adults. And back in 2015, we had pretty good success here in Ohio. We had 6 cities adopt the T21 ordinance. We had smaller cities that you probably have not heard of, like Upper Arlington, Bexley, New Albany, and Grandview Heights. We've also had larger cities that are nationally known, like Cleveland and Columbus, that have adopted the T21 ordinance. So that's been pretty exciting. There are 5 states in the country that have adopted a statewide T21 policy. That includes Oregon, Maine, California, Hawaii, and most recently New Jersey. And we have 13 other states who have policies in certain counties or municipalities. So at last check, there were about 271 different states, cities, or counties that have increased the age for tobacco use or purchase to 21. There we go. So like I said, this ordinance is complementary to other strategies that already are in place. We're not trying to replace anything. So those things include higher taxes, laws prohibiting smoking in the workplace and public spaces, as well as tobacco prevention and cessation programs. What's been successful? The theme of today's talk, partnering and education. So of course, partnering with pre-existing coalitions, both tobacco coalitions and health coalitions, and then creating coalitions that haven't existed or starting with partners that you maybe haven't worked with yet. And education, we've had students host community forums on the topic. Our students are very active in engaging the media of all different kinds, whether it's been writing into newspapers, being interviewed by the newspaper or the local media, or starting social media campaigns. And they've also been out in force giving testimony at city council meetings and not being very deterred, which is excellent. So some of the advocacy strategies that we've been using and we've done and we recommend are identifying your target cities, maybe not starting so large with the whole state, but starting with target cities, counties, or municipalities, identifying those gatekeepers and stakeholders in the community, and partnering with previously established coalitions. They can also help you identify those gatekeepers and the stakeholders, as well as increase your numbers and resources. And again, students have been key in leading those connections for us. Letters of support, write them, obtain them, start letter writing campaigns. Don't be shy about it. Go to and be heard at city council meetings. Students are often intimidated by this, like you saw in some of the results, but once they, in the previous study mentioned, but once they go, they kind of get the bug for it, which has been excellent. Host educational forums for the public. Invite the media to these. Don't be afraid to engage the media. Talk to them ahead of time about what's going to happen, how to be present during the educational forums, and then be available for interviews afterwards as well. And then, of course, writing in op-eds to newspapers is still a great strategy. So recommendations, partnering, over and over again. Advocates should partner with additional organizations to provide greater leverage and support in the community towards this policy. Letters of support could come from local agencies, hospital systems, school system, medical professionals from across the lifespan, looking at pediatrics all the way through cardiologists, and those in positions of social power in that particular community. Each community has its own personality, just like we do, and finding out who those stakeholders or support members are going to be will be key in helping be successful in something like this. And have those types of support ready. So if you already have letters of support ready, have those with you, or at least the names of those who are supporting you and you have letters from when you go to attend city council meetings. Bring that list of names with you so that everyone has access to that and have their credentials. We have a nice growing list here that, again, our students in both the undergraduate, graduate, and doctoral programs have been key in getting for us. Be aware of other health initiatives or ordinances that are already currently going on in City Council. So one of the other benefits of partnering with other organizations and coalitions will be gaining the knowledge of what other initiatives are already being considered by City Council. You want to make sure that you're in the know before you start asking for additional things. Find someone who is on board with the T21 ordinance, who's already in a leadership role in city government. This will make things much easier for you. And have multiple advocates at the ready in the community to be able to attend code committee meetings and other public forums to help speak in support of the T21 initiative and keep those advocates in the loop of all of your efforts so they're always current on what you might be working on. You're doing okay on time. So additional things to consider. So for us, this has been some of the things we've run into is point of sale ordinance. This is the point of sale ordinance that we're looking at. It's recommended not to grandfather people in, so there's not this carryover as you were 19 when this went into effect, so you're still allowed to purchase cigarettes. It would be just to start it at 21 as soon as it goes into effect. Tobacco and nicotine products, including e-cigarettes and hookah, are included in this. There would be fines for underage sales and enforcement of the policy by law enforcement. You see a little sign down there of what that looks like. It's not very different from what we already see for carding for alcohol and current tobacco sales. So some of the things we've learned, include the media from the beginning. Don't wait to get them until the end. The more that we can get this out, the more that people are aware of what's happening and the pros for moving on such an initiative. Right up as the newspaper for support. Tobacco21.org already has advocacy materials available to help you start on a project or help students start on that project. And opposition happens with most changes in policy. We've witnessed the changes, we've witnessed this type of opposition. It's very similar arguments when we've changed the alcohol age laws, seatbelt laws, and restricting smoking in public places. Change can be difficult, but difficult does not mean not worth it. Other things that we've run into that we've learned to take into consideration is timing of election season. So at the beginning of an election season, when candidates are out there running, we find they're quite ambiguous to commit during that election season. So if you can find a champion who's willing to do that ahead of time, that would really put you ahead of the game. Do that. And then at the other end of that election season is going through policy fatigue. We've had several council members use this term with us. So most recently, we had a lead abatement policy going through in Toledo, where anybody who was renting had to have the paint in the house tested for lead. We were also trying to work on this initiative at the same time. And policymakers were very fearful of upsetting their constituents with too much change happening all at one time. Here on campus, we have a campus-wide moratorium on smoking. There's a complete ban on that. And one of the successes we had was this, most of it was the student involvement. So we went to student government and we had a Q&A session with the student government officials, and we had our graduate students and our doc students go and answer those questions for them. And they were able to address all of their concerns. They appreciated having students talking with them rather than having faculty members coming and doing that. They found it less intimidating, and they were very quick to sign on to pushing that forward for us. And we also have student government supporting the T21 in Toledo initiative as well because of the same thing. Engaging other student organizations, also helpful. And we have letters of support from them as well to pull forward to the city. So always be prepared to have answers to questions. And these are some of the common questions that we see coming up. And again, we see these often when we're doing changes in ages. So regarding military age of turning 18, have some answers ready. Some easy answers are that the U.S. military is actually trying to ban the sales of tobacco products on their bases right now. And the U.S. Army Surgeon General said that soldiers who are smokers are less ready for combat and are also very slow to heal. So it's not something ideal that military would be looking for anyway. Community and law enforcement are already active in enforcing smoking laws. The only change is the age, so it's not anything new that they would have to be enforcing. It's just a different age that they would be enforcing that. So the last big component here is that tailored advocacy is important. You're going to have different angles that you're going to take, whether you're talking to a local business owner, a teacher, or the fire chief. It's always going to look different, both for the individual. It will look different, and based on the profession, it's going to look different. Find their angle and what hits home for them. Explore that before meeting with them, and then once you find out some more about them, explore it some more after meeting with them. Follow up with them if it's necessary or appropriate to let them know that you took into consideration what their concerns or thoughts were on that. So in conclusion, talk to your local colleges and universities about participating with health education, public health courses, and incorporating this type of advocacy into the curriculum, as you guys have talked about quite a bit this afternoon. If you find a particular angle, I'm going to talk a little bit, just a second here on speech and language pathology. I teach graduate and undergraduate students in speech and language pathology, and one of the things I have them do is get involved in primary intervention, and it tends to always run through our health education program. And we've had our speech pathology students also work with this T21 campaign, and it's been a great partnership with them. Each community is going to be unique and will have its own personality, and figure out what works and then speak to that. Advocacy takes time and dedication. That's one of the things that students have trouble realizing. This is a marathon, it's not a sprint, and it takes a while to get through to people and to get policies passed. So that is what we've had and what we've learned. Thank you very much.
Thank you all so much for sharing all of your experiences. I know that advocacy is such a crucial part of public health, and all of our initiatives and what we're trying to do. The summit is such a great opportunity. I hope that those on participating in the webinar will look more into that and hopefully be able to send some students. And I also think, thank you for sharing your guidance for developing and carrying out initiatives on various campuses and in various communities. I want to say thanks again to each of our speakers today, Elaine Auld, Cicely Hansen, Keely Reese, and Jennifer. And Jennifer Glassman, sorry. We did take the entire hour. There is so much great information that I'm so glad this webinar has been recorded so people can look back and reference all of the great information you all shared today. And their information is here if you'd like to follow up with them to ask any direct questions. I want to post up the address of the web page where this will be posted. The archived version will probably be available in the next day or so, and I will be following up with all participants, attendees, and registrants to let them know that that is available for viewing. And just a few quick announcements. The call for abstracts is currently open for the Undergraduate Public Health and Global Health Education Summit put on by ASPPH and AAC&U, and those submissions are due October 22nd. And finally, we have the next webinar in the ASPPH Presents series will be taking place this Friday from 12 to 1, and will be focusing on public health students in DACA. And you'll be able to see who the speakers are at that link on this projected on the screen now. And again, this is where this webinar will be archived. Thanks again to all of our speakers today, and have a wonderful rest of your Monday.
Thank you, Sarah.
Thank you.